So today I will be talking about the Cleveland EMS. So EMS stands for Emergency Medical Services, so they treat illnesses and injuries that require urgent response. They transport to definitive care, so they are pre-hospital. The first is EMT Basic, then EMT Intermediate, and then EMT Paramedic. So they do work 12-hour shifts, just like most people in the medical field. So it could be either 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. There are certain times where they can do overtime, so they can work concerts or festivals. I know my dad has worked a bunch of concerts, and he always works Little Italy, so you can always do that to get more hours even on your day off. So their education is EMT, which is the 3 months training, and then EMS is 9 months training, which is a 2-year degree, so it's your associate's degree. And then they do have in-services every month, so that is your recertification of all the training and information that you have learned. So every month they get tested. I think it's about a week they go to classes again, and then at the end they have a test, and you have to pass that test to get recertified. So some of their certifications that they do have are ACLS, which is Advanced Cardiac Life Support. Then there is PALS, which is Pediatric Advanced Life Support. BTLS, which is Basic Trauma Life Support. So that is where most paramedics get PTSD, since it is the most trauma happening in a certain instance for a patient. That is when there is the most stress that is happening. And then ILS is International Life Support. So paramedics are trained to deal with things over in different countries. So say a paramedic goes to a different country and something is happening with the person, they are trained to help them. So my dad is Douglas Sternick. He has worked for Cleveland EMS for 30 years. He did just retire in December of 2019, and he does have slight PTSD, so certain things can trigger stress for him, which my family and I have to work through with him. Since he is retired, he might not be eligible for the counseling. And also a fun fact is that he has delivered 10 children, which you don't think in emergency service, that's not your first thought of what they do. I just think it's very interesting that his signature is on 10 children's birth certificates. So what I have learned about a paramedic is that there is more training than I thought. I never questioned my dad how much he actually had to go through to learn all this information. So there is the 2-year degree that is shortened into just 9 months. Personally, I think that is just very quick and a lot of information to remember, a lot of procedures to do, a lot of medications to give to certain patients. And then PTSD is common in paramedics. Back in 2018, PTSD help was denied by the city of Cleveland. So now in 2020, the city is going to try to pass something so that paramedics can actually get counseling, and if the severity of the PTSD is very strong, they might be able to have time off. And I did realize that the medical field is not a right fit for me. I did find this out a couple years ago, hearing all the stories that my dad has told me. Also, my sister is a nurse, so that is, I get a lot of questions, why am I not doing it? And you can just tell certain professions just aren't the right fit for you.